In this edition of Ask the Doc, I got a question from someone who has been dealing with migraine headaches for years and has tried just about every type of treatment to get them resolved, all of which never seem to last, or the effects from taking medication produces some nasty side effects. In this video, I cover the following: some important questions to ask yourself when a migraine headache does come on, why getting a chiropractic adjustment isn't producing long lasting results, a common cause of migraines that can be treated successfully without medications or injections, and lastly, how do I go about treating migraines in my clinic? For those of you that don't know me, my name is Dr. Matt Maggio. I am a soft tissue injury treatment expert, specifically for neck, shoulder, elbow, and wrist pain. My focus is on finding and fixing scar tissue and then reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which does lead to a significant increase in overall functioning, flexibility, and long lasting pain relief. So, back at it for Ask the Doc. Just a reminder, you can send any questions directly to me on neck, shoulder, elbow, and wrist injuries. And if my insights can help, I'll definitely make a video. This week's question came to me from Instagram. The question was: I've been dealing with and sometimes flat out suffering from migraines for going on the past 5 years. I've had every MRI, CT scan, and imaging done they offer, all coming back with no real answers. I've gotten Botox injections, taken more medications than I can count. I've also seen 10 different chiropractors and have found I do best if I'm able to get adjusted at least 2 to 3 times per week, but it never fully gets rid of them, just makes them slightly more manageable. The 4 neurologists I have seen have no clue or answers. I am averaging 2 to 3 migraines per week, and my quality of life is next to nothing because I'm always worried that they will come out when I'm doing something. Nobody has any real answers as to what is going on, which worries me more each day and run out of hope. Any help or insights would be amazing. Thank you for sending this in. Sorry to hear you're dealing with all this. Like, nothing's worse than being in pain, not getting answers, getting the runaround by the medical system, and just losing your quality of life. And I'm really sorry that all this is happening and that you're having to deal with all this and just getting thrown around and not getting any real answers. So I'm glad you reached out. I'm going to try my best to answer this. So, some important questions to ask yourself when you get a migraine headache and when it does come on. Number one was: is there neck pain before you get the migraine? Does the migraine come on by itself, or was there like tightness maybe in the neck, down in the traps, in the mid back as well? Next one is: does it come on at certain times a day, or is it more sporadic? Is it usually in the morning? Maybe stressful throughout the day? Is it following those type of factors, or is it kind of really just come out of nowhere and there's no real rhyme or reason to it? And the last one was: does it cause you to get nauseous as well, or is it more just like a pain and throbbing? So, what I always like to see is that it's neck pain first. That's telling me that it's some type of structural issue, possibly in the neck, that's referring some pain up and creating those migraines. I also like to see more of a sporadic type of migraine, one where it's like there's no rhyme or reason, where it just kind of comes on. It's not like, oh, every day after I pick up my kids, I get a migraine like 10 minutes later because they're running around crazy, or as soon as I get to my office and I'm stressed for the day, I'm going to have that migraine. I want to see more of like a sporadic type of presentation. Then the last one is: I don't want to see like nausea or like feeling of sickness. I want to see more of like pain and throbbing. That's pointing me more and more into that direction of it's probably a structural issue in the neck that we can adequately address. So, why getting the chiropractic adjustments isn't producing any lasting results? I talk about this all the time. Anytime you get an adjustment, what it does is it stimulates some stuff in your spine, temporarily feels better, blocks some pain. You do feel better. It's improving the symptoms, but it's not actually addressing the function of the area, which is why this person isn't getting that long lasting relief. I kind of say getting an adjustment is kind of like when you jam your thumb in the door and you shake it out. It does block that pain a little bit, but it's not really actually changing anything. So the only reason they're getting a little bit of relief is because they are stimulating something, they are increasing some blood flow to the area, but they're not actually removing the problem that is there, because it's not actually a problem with the bone or the joint. It's usually the tissue that's surrounding there. There is a really, really common cause of migraines that can be treated successfully without medications or injections, especially if someone meets that criteria of like they get the neck pain before, It's sporadic, and it's more just that throbbing and pain type of presentation. And what it is, it's actually an entrapment of what's called the greater occipital nerve. So you have this nerve that runs right up the base of your skull. And it goes right over top of some really deep muscles in there. And when we spend a lot of time stressed out, looking down, sitting, those muscles in that area, they get overworked and they develop a lot of scar tissue. When you get scar tissue, it makes the muscle weaker, less flexible. Over time, that scar tissue gets bigger and bigger, and eventually it does get stuck to the nerve. And when the nerve gets caught, gets really angry, it gets inflamed, and that nerve controls this whole area of the head. And I've seen so many cases where people have chronic neck pain, but they also have an entrapment of that greater occipital nerve. So what I want to share first here is a treatment demonstration video of how we actually treat the greater occipital nerve using just our hands, no injections, no surgeries, no pills, to really break that down. So I'm going to link that up right now.
This area is dysfunctional. It can cause a lot of problems in there, but you don't want to go too far. You go to maybe about C3 is the furthest you want to go. Get some of that extension to open it up. And then you're going to pull that tension straight up. That's going to help that open up. What can happen, at the base of the occiput from C1 down to C2 is there's some nerves called the greater occipital nerves. They can get stuck to the deep suboccipital muscles. They can get caught through the upper trap. They can get caught in a lot of different areas. And if you can get in there and get some of that tension, it's going to allow this to help to glide a little bit better. And that's going to open that up. You're going to go down and find about C2, C3. And where you're going to go in there is you're going to sink, just like that. And then that's going to get your depth as you open up. And then you're going to pull tension straight up. And with this one, you're not going to stand up. You're just going to pull that. And you're going to lean back and pull that through as you go right up to the base.
So a couple things with that treatment demonstration. You can see it's very precise. It's very focused. It's very slow. We're not going in there and trying to beat the hell out of the tissue. Nerves are very temperamental. They don't want a lot of pressure. They just need some tension to break that down. So we go slow, easy, and effectively break that down. And when we treat these in our clinic, like I said, we want to see the neck pain first, then the headache, and we only want to see pain, maybe some throbbing and things like that. We don't want to see nausea or vomiting or things like that. That's telling me more it's like a chemical component that isn't actually related to the neck. And as you saw in that video, we really slow down. So there's a lot of questions to ask. A lot of providers out there, they just jump right into treatment. And they're like, oh, yeah, you got migraines. We're going to do this protocol and see how it goes. But you need to get all the information in there, really get a detailed consultation and get to a doctor and a provider that can really get to the root cause of what's going on. And if you've been dealing with migraine headaches, yourself for at least 6 months, you've seen lots of other providers, you've gotten no pain relief or improvement in symptoms, then you can reach out directly to us and you can set up with a peak method provider to get some real answers and on the path to functioning and feeling a heck of a lot better. All the information to do that can be found directly on our website, and it's linked up wherever you're consuming this video. I appreciate you guys watching, and I'll see you on the next one. Bye.